one of the things that I do a little differently than most chiropractors is cranial work. Something that you'll notice while I'm working on you is that I'm going to be rubbing your head, which is a little different than what most chiropractors do. Why am I rubbing your head? Well, the fact of the matter is that we have actually joints in our skull. They look a little bit like a puzzle piece, and they join together in many different places. You can see all the different colors represent different cranial bones of the skull. And they're supposed to flex and bend a lot like a door hinge to allow the flow of the cerebrospinal fluid that is made inside the brain, goes down the spinal cord, back up the outside of the spinal cord, and then cushions and protects the brain. It also delivers nutrients and oxygen, and it removes toxins and metabolites. So if you get headaches at all, if your cranial bones are jammed, cranial work may help to get rid of some of those headaches. Specifically when we're working on sinuses, for instance, see that red bone in there? It's kind of bat-shaped. Well, that's actually called the sphenoid, and the only place that you can really contact that bone is right here, kind of near your temporals here. So if you feel me rubbing your temporal bones, I'm just checking to feel how that is sitting in your skull cavity, and if it's rotated, if it's been twisted like this, or if it's laterally flexed like this, or if it's completely shifted forward or backwards, and we're playing around with that. So anyhow, one of the things that you'll notice that I do a little differently than most people is cranial work when I'm rubbing on your head. So usually I'll do a quick scan and then I'll just move on, but if I find a spot that's particularly stuck, we're going to work on that for a little while, and I just might hang out there rubbing on a spot on your skull. And if it's really jammed and you happen to have a headache or some sinus issues, I may even use the rapid release, which I'm sure we've talked about in another video. Alright, if you have any questions, definitely ask. Thanks.